Coming to the operations that can be performed by laparoscopic surgery, we started performing major surgeries in 1990 onwards, and the first ever surgery was removal of gallbladder for infection and stones inside the gallbladder, after which we started doing several other surgeries. Today we do almost every surgery in the abdomen by laparoscopy itself. We do not have to cut open. Extremely rarely are we forced to do this, either because there are a lot of complications because of previous surgeries or because of the disease itself. But by and large, the ailments that are commonly dealt with by laparoscopy in GI surgery, that is gastrointestinal surgery, are removing the appendix, removing certain parts of intestines. It can be the large intestines, either because of disease, obstruction or cancer, removing parts of stomach, removing pancreas, removing gallbladder, bile duct surgeries, esophageal surgeries. There may be achalasia cardia, which causes dysphagia. There can be GERD, that is gastroesophageal reflux disease, either because of hiatus hernia or otherwise, and all this can be treated by laparoscopic surgery. One of the most common surgeries that surgeons perform is hernia, and almost all different types of hernia disease is now dealt with by laparoscopic surgery. We are also able to put large meshes that cover the whole of the abdomen using laparoscopy, and many failures after open surgeries and recurrence of hernias are also dealt with by laparoscopic surgery. Coming to diseases that affect women, almost all different diseases affecting the uterus, the tubes and the ovaries can be dealt with by laparoscopic surgery. Infertility procedures are very common, so they can also be surgeries that are performed on the uterus, removal of fibroids, tubal surgeries where there are blockages in the tubes which need to be released, and ovarian cysts that need to be removed, like polycystic ovarian disease. There is a procedure called ovarian drilling which has very high fertility rates. It is really a successful surgery in infertility. Apart from this, there are major problems like endometriosis, which can be dealt with, whether it is in the ovary, over the uterus, which has spread around the female genital organs, or even cancers, cancer of the uterus, cancer of the ovaries, cancer of the cervix. All these can be dealt with by laparoscopic surgery. In cancers, we not only remove most of these tissues, but we also try to remove the lymph glands that are along the great vessels in the pelvis and along the aorta. These are very major surgeries, but experienced surgeons have been performing these surgeries for more than 2 decades now. In ovarian cancers, we may have to remove even the omentum, and this can also be done by laparoscopic surgery. Coming to the recent things, we are able to do even transplants, removing a kidney from a person who wants to donate his kidney can be done by laparoscopic surgery. Even liver transplants today in some centers in the world are being done by laparoscopic surgery. Now, obesity has become a major issue, and bariatric surgery has come as a real big boon for people who are obese, who are not able to reduce weight. So, through a small laparoscopic surgery, they can have long-term weight loss and then get back to normal life. Diabetes is being cured after laparoscopic surgeries, especially metabolic surgeries and bariatric surgeries. India being the capital of diabetes, this certainly has a huge potential, and is doing human service to people. Now, there are a whole lot of times we just have to do a diagnostic laparoscopy because we do not know what is the cause of pain. We want to know whether there is tuberculosis inside, whether the cancer has spread from one place to another, if there are staging that is required for cancer diseases. All this can be done by laparoscopic surgery itself. Laparoscopic surgeries can also be done on the urinary tract. Kidneys which are diseased or even having cancer can be removed by laparoscopic surgeries. There are multiple problems along the ureter, starting from stones to strictures, pyeloplasty, urethroplasty, ureterolysis, all this can be done by laparoscopic surgery, and certain operations on the bladder and on the prostate, especially cancer surgeries, are also performed by laparoscopic surgery.